Hi and welcome to this video. I actually got a brilliant question from a member of the No Kegel system. She wanted to be able to really visualize her vagina and needed some support in that visualization. So she asked for a 3D video of a vagina, and I found this one, and it's actually pretty good. Like, I was very skeptical because I have a different perspective than what's out there. But I think this gives a really nice and clear image and also like additional knowledge that probably we should have been taught in school, but we weren't, which is sad. So I wanted to share it with you guys. I am posting the link, of course, below if you want to see it in the full version. I'm gonna jump into different pieces here. But let's jump straight into it. As you can see here, this is like, I think most of you have seen this, but this is like cut, um, a body cut in the middle from the side. And yeah, she will explain everything here.
Vagina. The vagina or birth canal is a sexual organ that is part of the female reproductive system and plays multiple roles. It facilitates menstruation, childbirth, and sexual intercourse. The vagina.
I actually just wanted to stop here. We have not come far in the video, but when women are working with scar tissue, I have had a few questions, especially on this part of the front vaginal wall. And as you can see, it's both like on the front and on the back. In the beginning, it's a bit like small bumps almost, and much more than higher up. This is almost softer tissue, and this is a little harder, not hard, but harder, and with these tighter bumps. Like here, it's more like woo, and then comes another one, and you can't feel them in the same way. And I have had women who asks, "Is this scar tissue?" And of course, it might be that there is some scar tissue there, but this part of the vaginal walls itself are formed this way. So just, keep that in mind when starting to explore any scars in your vagina.
Also plays a significant role in human female sexuality and sexual pleasure. Gross anatomy. The vagina is a fibromuscular tube roughly 8 to 10 centimeters or 3 to 4 inches long across the posterior wall and about 7.5 centimeters or 2.5 to 3 inches long across the anterior wall.
And I hope that all of you understand that these are just like average and like from a general perspective, of course, this can vary. And also, I'm not sure if it's always the case that the anterior wall is shorter. I, for example, and I know many other women have a tilted uterus, which means that the uterus actually goes this way. So it's like backwards. And I think maybe that can contribute also to the front wall, the anterior wall being slightly longer or like the same length. Of course, it doesn't have to be the case. I just want to emphasize that we're all unique, and it's not that this is like the correct version. It's just for us to get some kind of image to relate to in our heads.
It extends from the vulva to the uterus. The vagina includes the following parts: vaginal orifice, incompletely covered by the hymen; vault, which is the upper end of the vagina; fornices, anterior, posterior,
Okay, I was a bit slow there, but vault that she mentioned, many of women that I meet and talk to have a vault prolapse, and that means that everything is lowered. So everything is situated in a lower place than compared to before. And that can also be the case for many women without even being aware of it or feeling limited by it. Um, but I just wanted to mention that wording. So let's go back to the video.
Anterior and lateral, which are recesses formed as the vagina surrounds the cervix. The anterior and posterior vaginal walls are usually closely opposed, diverging at the vaginal vault and fornices. Relations. Anteriorly, it is related to the cervix, bladder, urethra. Posteriorly, to the pouch of Douglas, denonvillier's fascia, perineal body. Laterally, to levator ani, pelvic fascia, and ureters. During sexual intercourse or coitus and sexual arousal, the vagina will expand both in length and width, while the upper two-thirds of the vagina expands and lengthens. The uterus will rise into the greater pelvis, with the cervix being elevated above the vaginal floor. The vulva includes all of the external organs seen outside the body, which include the mons pubis, which is Latin for pubic mound, labia majora, or the outer lips, labia minora, or the inner lips, clitoris, the external openings of the urethra and vagina. Vagina does not have glands, where it is lubricated by serous fluid through transudation by mucus from the cervical glands, which are seen above it. Vaginal secretions can also come from the uterus or a minuscule amount from the Bartholin's glands upon sexual arousal. The wall of the vagina is thin, consisting of an outer adventitia, middle muscularis, and inner mucosa. Histologically, the vagina has a stratified squamous, non-keratinizing epithelium with a thick and vascular lamina propria and a muscular layer. During menstruation, the
Okay, so a lot of words there, but what I really think we could gain from that image, like from this part of the animation, is just a sense of when we are working in the vaginal walls, there are different layers. So the top layer, middle layer, and muscle layer. When we are working with scars, it might be that they actually go all the way into the muscles, or they might just be like on the surface. And this is where I think it becomes really interesting with different types of pressure, both in like how hard do we press towards the scar, and also adding any type of movement. And what's almost like most exciting and interesting, I think, is what emotions arises. And if you have a really deep scar, you need to work with it more consistently, deeper, and I would say more pressure, at least over time. We never want to uh, do anything that's too painful so that we lose our breath, or it's too sharp, but we really want to dig deep into those scars, and we need to reach all the different layers.
vagina allows passage and expulsion of the endometrium, which is shed on a monthly basis at the end of the follicular phase. Throughout the menstrual cycle, the epithelium will undergo subtle changes where the rate of desquamation will be higher during the progesterone phase than during the estrogen phase.
And this is the reason many women feel, especially prolapse symptom, shifting during the month. So if they come closer to their period, they will have more estrogen, which will affect the tissues in a different way than when progesterone is the dominant hormone, affect the tissues in different ways. Also, women who reach menopause and beyond, many women experience pelvic floor dysfunctions for their first time when they reach menopause. And that is because the vaginal mucus tissue is so connected to hormonal changes and hormonal imbalances and balances in the body.
During childbirth, the vagina expands to allow the baby to pass through and provides pulsatile contractions to assist the downward passage. A healthy vagina of a woman of childbearing age is acidic, with a pH range of 3.8 to 4.5 due to the degradation of glycogen to lactic acid by enzymes secreted by the Dorderlane's bacillus, which is part of the normal flora of the vagina. The acidity functions to retard and prevent growth of various strains of pathogenic microbes. An increased acidity can be caused by bacterial overgrowth, as in bacterial vaginosis, trichomoniasis, or the rupturing of membranes during pregnancy. Blood supply. Arterial supply of the vagina is mainly by the vaginal artery, which is a branch of the anterior division of the internal iliac artery. Other arteries that have a minor contribution in vasculature of vagina are uterine, internal pudendal, and middle rectal arteries, all of which are branches of the internal iliac artery. Venous drainage is by the vaginal venous plexus draining into the internal iliac veins. Lymphatic drainage. Upper 3/4 by the internal and external iliac nodes. Lower quarter by superficial inguinal nodes. Nerve supply. There are numerous nerve endings near the entrance of the vagina, which is lower third, making it more sensitive to touch than the deeper and inner 2/3 of the vagina, that provides sexual pleasure when stimulated, and sensory fibers arise from the pudendal nerve, while pain fibers arise from sacral nerve roots. Clinical notes.
That is so fascinating. And as you know, many of the methods that I share here are aiming to activate the nerve endings. And what we really want to activate is the pleasure side of the vagina and the pelvic floor and everything surrounding it, and trying to decrease where the pain sensors are in the nervous system. So we are relearning the nervous system, how, like, from where we want it to pick up the signals. And by doing all the methods like hypopressives, vaginal steaming, scar tissue remediation, suppositories, the list goes on, we are really creating a great environment for the pleasure side of the nervous system to awaken again.
Common infections and diseases that can affect the vagina include candidal vulvovaginitis, vaginitis, vaginismus, sexually transmitted infections, or cancer.
So that's all for today. Thank you so much for watching. Leave comments below if you still have questions, if there are things that you really want to have clarified, especially when it comes to practicing scar tissue remediation, which I really hope that any woman can practice safely at home, feeling confident enough to know what is scar tissue, what is not scar tissue, and how shall I work with this, because it is such a fantastic method, especially when experiencing pelvic floor dysfunctions, but actually for any woman.